Hello, my name is Jessica Diaz-Gallo, and I will be presenting today on group cognitive behavior therapy to treat PTSD, also known as post-traumatic stress disorder. So my slides were focusing on the theory and techniques of GCBT, so group cognitive behavioral therapy. These groups are typically conducted in a closed group setting. So closed group is that, once all the members in the group have integrated that group, no other member outside of the group can join. So it'll most likely be the same group of people joining that group. These groups include skills training and trauma-focused techniques, which are exposure and cognitive reconstructing. I do offer some examples there. When a group has an exposure component to them, they may include imagery exposure to the memory of trauma. So that could be, doing like a little replay of that traumatic experience to help the group members overcome their traumatic experience. This could also be done through multiple ways. It could be done through writing. GCBT is known for some other techniques to be homework. And homework can be done by giving the group members a prompt, telling them to write in a journal, bring it back within the next session, and then go over what they wrote, the feelings that they expressed while they were writing it, the emotions, just anything that will allow that member to open up a little bit and be able to discuss their traumatic experience. Speech within the group setting. This may be something that a lot of members have a harder time with at the beginning, just because they're not really that open to the other group members or might not feel comfortable, but that is something that may be allowed. Once that trust and that comfort comes into play, speech within the group setting is another one of the techniques. Listening to session tapes for group members. So this I mentioned because I found in the research that I was reading, but I know that confidentiality is one of the main aspects of therapy. That's why I put it on there, that this might not be ideal for the group CBT, but it could be allowed within an individual setting. And I just wanted to put that out there. Going further, so modifications needed for group cognitive behavioral therapy. So there are going to be some modifications that are going to be brought into the group in order for this to function correctly. So some patients who have been diagnosed with post-traumatic stress disorder may find it difficult for them to trust or be trusting of any group of people. It doesn't have to be the people in their group, just any people, any person, somebody new. It's just something that, they have a harder time with, and that is okay. But modifications do need to be made so that the group carries out a successful group therapy. Modifying their communication skills within the group. So for some members, it may be hard, like I said, to open up at the beginning, but once they find that trust and once that find that comfortability to be able to open up, that is something that that will benefit the group a great amount. And depending on the group, relaxation techniques can also be brought in, and that can be another form of modification for the person. So depending on how the person reacts or responds to a situation, if they learn those relaxation techniques and they use them in their day-to-day lives, or when something they didn't expect to happen happens, they're able to modify their reactions or the way that they respond to that, right? So this research, I'm covering 3 sections on research. So the first one is Sloan, which was conducted in 2016. It was a study aimed to examine the effectiveness of group cognitive behavioral therapy, so GCBT, in comparison to group present-centered therapy, GPCT. It's a little bit scrambled with all the words. But the sample size of this study was 196 male veterans that were diagnosed with PTSD. So I did put on there that they were veterans. A majority of them were veterans. But as you can see here, we're going to jump a little bit to the included in the study. It's also included anybody who was diagnosed with PTSD related trauma. Going back, so that sample size was divided into 98, two groups of 98 people who were either going to be in the GCBT, which is the group cognitive behavioral therapy, and the GPCT, which is the group present-centered therapy. So obviously, there are not going to be those big groups that were then divided into little smaller groups. But each treatment group did and was led by two therapists over 14 sessions that were scheduled across 16 weeks. Assessments were taken before the treatment, during the treatment, and after the treatment, as well as they did a follow-up with each individual that took part of that study in 3, 6, and 12-month basis. There were some exclusions to the study. So women were an exclusion to this, and I had read on the article that the reason why there was no women really participating in the study was just because of the lack of participants, women participants. They couldn't find enough to make it an evenly correlated study, so they decided to exclude them and just focus on the males. Also, individuals who had been diagnosed with substance dependency, those excluded in the study, and individuals diagnosed with unstable bipolar disorder, or any other individuals who were doing other types of treatment. And the reason why is because it was just going to be a little bit difficult to determine if the results were from this particular study or from another therapy that they were attending. So the treatment condition, the GCBT group focused on the nurturing group and cohesion. Like I said, they were given homework and for participants to do between sessions. Exposure items included progressive muscle relaxation, like stated before. So they really focused on those two things mainly. And the results were that the GCBT group displayed a significantly greater reduction in PTSD symptoms compared to the GCPT group. Continued. So another research that I had found, another research article, was Thomas Holland's. He conducted this in 2018, which was studying the initial levels of patterns and change of alliance in group treatment focused through GCBT in clients with PTSD. So this study focused on the success rate that it was when this group established alliance, right? So this group therapy was found to increase the opportunity that individuals who suffer with PTSD reduce their social isolation, which is one factor that members to not really allow themselves to open up, right? So this group with these members, obviously they have similar experiences and they share the same symptoms, which allows for an individual to feel a little bit more comfortable and a little bit more willing to open up and share those experiences. In this study, GCBT group conceptualized PTSD into 4 symptom clusters, which were emotional, physical, behavioral, and cognitive. The study, so there were 178 participants in this study, most of which were male veterans who were diagnosed with PTSD. The treatment conditions for this study were, like I said, they were based on those 4 symptom clusters, which I just mentioned. And they were targeted directly through relaxation training. Once again, that's that muscle relaxation. That was included. And then the cognitive therapy, behavioral practice, addressing emotions, relapse prevention. The results for this study was that it demonstrated a significant variability across alliance ratings. So the rate of alliance growth which was much more rapid for participants in the GCBT group. Going on, so why GCBT? For patients who are diagnosed with PTSD. So patients with PTSD are often known to socially isolate themselves, have a harder time trusting others. The option for this group creates it for these members to have a safe environment, almost as if it could be a support system after therapy if they do wish for that to be it. They can become more socially connected with others and allows for them to create a more trusting environment for others as well. So it's they kind of like feeding off of each other's positive energy, right? It's like they help you, it's members are mutually helping themselves out. The struggle with a lot of patients that have been diagnosed with PTSD is that their symptoms and experience, they might believe they might believe that there's nobody out there who can share them or who can help them with those experiences, because maybe nobody has lived through those experiences. But yet when they go to therapy, they realize that a lot of people have gone through those experiences themselves, and they can even help each other out. With group therapy, patients with PTSD, they not only work on their social connections, but they're able to normalize their symptoms and share, they share the same ones with others. And also group treatments can maximize limited staff resources. So, obviously this is something that is new, not PTSD, but GCBT for PTSD. So resources may be limited, and being able to work together as a group can work out perfectly for staff, for limited staff and resources. And that's pretty much it. Everything else my group members are going to be presenting on. So thank you so much for listening to my presentation.